All right. So again, I'm going to give you some trends, but I'm going to give you some very specific concerns that we have in Washington State here. The trends are numbers are as Dr. Shaw outlined earlier, up over 266,000 on our webpage at this point. But again, the hot spots in Washington remain the same: Snohomish, King Pierce, Yakima, Clark, and Spokane. The darker the county, the higher the number of cases. So not much has changed here. We continue to have cases in the same spots throughout the state, mainly. But what has changed is this very concerning blip in cases. So you can see one of the main concerns is we're at a higher rates than we have ever been since the beginning of this in March. But we were very happy, and I talked about last week, a downward trend, which unfortunately has shown an increase again. And so many of our counties are showing this sharp increase. We don't know how far this is going to go. A reminder that these gray areas are not complete data yet. So we don't know if this is going to go way up here or if it's going to drop off. But the concern very clearly is we're having spikes in cases in many of our counties across the state. And so that falls back on the very specific guidance of wash your hands, wear your mask, and watch your distance, 6 feet distance. These are the tools that help us control disease. Vaccines are the light at the end of the tunnel, and it's great, and we're going to talk a lot about that today. But I'm going to bring us back to the 3 W's. Wash your hands, wear your mask, and watch your distance, because we have a spike in cases across the state, and we don't know where this is going to land. Those are the 3 tried and true measures that we can do. When we look at hospitalizations, it is not following that same concerning spike, but hospitalizations usually follow behind the increase in cases. So we remain at a flat or decreasing level of hospitalizations, with still a big difference between the older age groups, or the average, and our younger age groups, 0 to 29, 39. So those remain flat or decreasing. So we will watch these carefully. A more detailed look at those hospitalizations do show, even though we're at a very high rate here, higher than we have been before, there is this downward trend. And again, where will this spike in cases across many of our counties in Washington translate into hospitalization impacts? That is unknown. So we're in a very tenuous position given the height of these bars as well as the trends of these bars. A lot of times people ask to predict out. We do work with many different modelers. These are the calculations of our projected cases through 118, which follows this same trend of upward cases. So we are not flattening out, we are continuing to rise. So that is, again, controlled with our social distancing, mask wearing, hand washing, and hopefully an effective vaccine. One of the things that we watch carefully is what is called the R naught, or the effective R naught. So the number of cases that are created by a single case of all the people that are susceptible, and anything below 1 is where we want to be. And you can see we dipped below 1, but again, that trend we are seeing has brought us across the 1 to a higher value, which means there's ongoing transmission. And at this point, we've seen big differences between the East and the West, and you can see they're fairly minimal now, but there's mild differences between the R naught or R effective across the state. Again, this increase here is a concern that we're seeing in case counts and what we're worried about.